techniques and tools at our disposal that are well known, that we know that work, and are very, very inexpensive. One of which is to wear masks. And I'm getting a high sign about masks, but I'm going to keep wearing this. Well, I'm going to be unmuffled, but I'm wearing my mask today. So we listened to a fellow named Jerome who is works in a retail store, and he told us how critical it is to save his colleagues from getting this disease, and how important it was to have his patrons who he's feeding to wear masks. And in response to John Weisman's requirement to wear masks, he had a really simple message. He said, hallelujah. Hallelujah, because it gives a chance to save himself from getting this disease from his patrons. So the good news in Spokane is that we found out today that we have both the will and the way to start reopening businesses, and that is to start wearing masks. And one of the folks came up with a slogan that I thought was appropriate. 100% masks means 100% businesses getting open. And that's a really great goal for Spokane County. And we know that this is very achievable. We know that communities do that. We know that there's many communities, 90% of people wearing masks when they're going into grocery stores. We know that in Yakima County, the percentage of people who wear masks have gone from 35% 2 weeks ago to 60% last weekend. And the reason that is happening is people are learning what a mask can do. Now, here's what a cloth mask does. I think this is an important point. A cloth mask is mostly about showing you care about somebody else, that you want to prevent yourself from infecting another person. A cloth mask is not so much a sign that you care about yourself, it's a sign that you care about other people. And if you are a rugged individualist who embraces the far west values of rugged individualism, there is nothing incompatible about that of saying you want to take care of your grandmother or your grocery store clerk or your nurse or your barber or your neighbor or your son or daughter. So this is something that's available to all of us of both parties to demonstrate that we care about other people. And this is why this is so important. When we are walking around, we don't know if we have this virus or not. It's a sneaky little bugger because it doesn't tell us when we have the disease. So we may think we're just fine and go to a birthday party and infect a bunch of kids who then go infect their grandparents if we don't wear masks. So I'm really encouraged about the recognition that we can start to reopen Spokane if we start to arrest this virus. And we can do this if we start to wear masks. The literature is very compelling. This is why they are being used around the world. And the science is now clear that they can reduce the rate in transmissions if they're worn. And the beauty of them, virtually any mask can help out. So red, blue, cotton, wool, they all work. So we're giving people the liberty to decide whatever fits their style and their comfort level. And so it's a very flexible approach that we have. Now, there are other things that are going on really well here in Spokane I heard about. One of which is there is a group of 300 volunteers who are supporting families while they have to isolate. So when you become positive, you need to isolate for 14 days so you don't infect other people. And there is an effort here, combination of the Health District and the Spokane Alliance, that is supporting those families and helping those families. They've been giving people pulse oximeters so you can measure your oxygen level. So if your oxygen level goes down, you know you can go to the hospital. And I'm just really excited about that. I was so excited that I honored one of the leaders of that effort. Her name is Ravneet Wyrich. She is a second-year WSU medical student. And today I named her the Washington of the Day, because I'd like to see what Spokane is doing replicated across the state of Washington. I'm going to brag on Spokane across the state of Washington. This is a community that can really pull together. And when it pulls together, really great things can happen. And it is pulling together. So long and short of it, I'm inspired from what I heard today. It gave me a real sense of hope here, and that sense of diligence and togetherness I think is going to suit Spokane really, really well. With that, I'd like to yield to Dr. Dan Getz, who's an emergency room physician by specialty, and he's the medical officer for Sacred Heart, to make some comments about the current status in Spokane. Doctor.
Thanks, Governor. Well, thanks, everybody, for having me. Thanks again to Governor Inslee for coming and helping us out at the local level. On behalf of Providence, our vision, values, and mission has always been to care for those most vulnerable in our community. And I think what we're seeing right now in our regional incidents is that we see our community as being incredibly vulnerable. And so that's why we've come behind to support the recommendations of Bob Lutz, the Spokane Regional Health District, and what we're seeing in the data in our trends. And when we look at our infection rates here locally, they're higher than they've ever been. And if we don't implement measures to reduce that infectivity rate that are not, or the degree of spread that Governor Inslee mentioned, we could approach levels that rival what they had in Snohomish County in March, which would quickly overrun our hospital system. In the last week, we've seen our hospitalizations almost triple, actually, at Sacred Heart. When we work with our partners at Multicare, they've seen increasing numbers both at Deaconess as well as their hospital in Valley. We've seen increased numbers at Holy Family Hospital. So what Governor Inslee mentioned that's critically important, the one thing that we can do to reduce spread is wear masks. And I think it's really interesting when we look at our regional data, those people getting infected right now, this first wave we're seeing, are between the ages, the vast majority of them, between 20 and 40 years old, which makes me think that's probably the most of the people that aren't wearing masks right now. And the thing about being in that 20 to 40-year-old age group, you're probably not going to get that sick. We understand that. But that person who has lots of medical problems that's over age 60, they're the ones that we really want to protect. So when you put that mask on, you're protecting the most vulnerable people in our community. That child with cancer that's got chemotherapy, appointments. If you give him the disease or her the disease, that could be catastrophic even for a young person. So really, to reiterate what Dr. Inslee had stated, wear the mask. I mean, the science is good. What it does, it's not a political statement. We're doing this to take care of others. It's inconvenient. Nobody likes wearing them. But if you're in a situation where you can't distance, it's the most important measure that we can do. Spokane's rallied together. We've done great things to try and reduce the spread of this in our community already, but don't let up. This is a simple measure and incredibly effective.
All right. Thank you, doctor. Thank you. I appreciate Dr. Getz elevating me to doctor status. I appreciate that.
Oh, did I?
But that's a...
It's like the Washingtonian
yes.
debate.
I'm not a doctor, but I can read. And what I've read, it shows that masks work. It's just really simple. Masks work. Mask saves lives. Mask shows that you care about other people in your community, and that's a good reason to wear them. This should not be something that's a partisan issue at all, because both Democrats and Republicans can die of this virus, and both Democrats and Republicans care about people around them. So we're confident we're going to make progress here. We have John Weisman here as well, our Secretary of Health, the Secretary of Health is actually the person who issued the order. I just support it. And Dr. Rocky Bono, Admiral Bono, who's been responsible for helping our medical institutions get ready for this. For that, be happy to stand for your questions.
Governor, the mask mandate is really being sold as, it seems, as like a silver bullet. So if people follow this mandate, if everyone really gets on board, could we essentially see Spokane County move forward in the next 14 days? If we really follow this in the next 2 weeks, could we see Spokane move forward into the next phase?
Well, anything is possible. So we would hope that we would have some extremely dramatic improvement in that regard. Usually these things take longer than 14 days to show a result. So if we had 100% mask usage starting tomorrow morning, it probably would be more than 2 weeks before you saw dramatic changes, because it takes time for the virus to work through the system. But there have been places that have seen at least some change in like a week to 10 days. So if that happened, it's possible. I would not bet the farm on it. But what I can bet the farm of is that the only path we have open to us, or the best path we have open to us to reopening, is this usage of masks. And it's because we don't have a vaccine. And so when you have a path that can save your community economically, that is so simple and so available and so universally acceptable, frankly, around the world, I think we ought to take it. And so I'm very excited about this.
What would need to happen then for Spokane to slide back a phase, Spokane County rather?
Well, I'll just give you an example of this. When we allow or call for a county to go from phase 1 to phase 2, we look for the infection rate to be no more than 25 per 100,000. Okay, so that's kind of the criteria to move forward.
Right, we're going backwards.
I'm getting to that. I'm getting to that. Spokane is today at 49.9. It's twice that level already and rapidly going up. So I think you see the concern. Now, how far does it have to go up before we would have to go backwards in a phase? We do not have a magic number about this. But when we start to see something that is unstoppable, that means that the hospital system is going to be overrun, and you get into a decision like Yakima today, which really has had to ship patients over to other communities like Seattle, and we're having to hire new ambulance services to do that. When we see those conditions start to arise, you possibly would have to go backwards. But we don't want to think much about this. Look, this is so, what's the word? Simple, right? We don't have to buy a new CAT scan. We don't have to invent a new MRI machine. We don't even have to invent a vaccine. We just got to wear a little cloth in our face until we get a vaccine. And hopefully this is not a permanent issue. Yes?
At what point would you consider instituting a Yakima type order in Spokane? And then I had a question about hospitals too.
Yeah, the question is when would we do what we're doing in Yakima, which is a requirement not only on individuals to don a face covering, but also for businesses to not do business with people who refuse to honor that commitment. And that is something we could consider if this other approach is not working. If we become convinced that Spokane's heading for a disaster because it won't have hospital capacity, and if people don't abide by this order, under those conditions, we could go to the next step, which is to require businesses essentially to not do business with people who won't follow the order. That would be the next step, probably, that we would take. And this is, the businesses, to me, it's fair to protect the people who are serving you. When a person works in a grocery store and we don't wear a mask, so we expose them to a virus, and they're feeding us food, I don't think that's fair. I don't think it's fair to expect grocery store workers to put food on our table and we won't be considerate enough or stubborn enough, frankly, to wear a little face covering for a few minutes when you go in the grocery store. I don't think that's fair to them. And it's not fair to the bookstore owner when you go buy a book. They have a job to do. They don't have a choice. And you walk in there and infect them. I think we can do better than that. You have a question?
Yes. My second question is about hospitalizations. We are sort of the regional medical
Yeah.
hub here.
Yeah.
And I know we've been taking some patients from the Tri-Cities and Yakima. And I'm curious if that flow is going to continue, if that's something that you guys discussed today with hospital leaders. Is that sort of the plan going forward, that because Spokane has enough space, we're going to welcome some more COVID patients here, or what that looks like?
Dr. Bono, you want to talk about that, or either one or both?
So one of the things that we looked at here in the state of Washington, which is extremely important, was taking a look at the capacity across the state. What we wanted to do is avoid any one hospital having to go into a crisis mode. And so part of the agreement among all the hospitals is that they would help each other out. And that really continues to help each of the counties. And so others are watching to see how you're helping out in Yakima. And if that should be something that we need to do in Spokane, then other hospitals are standing by to help out in that way. Spokane has done a wonderful job, though, with your hospital systems here, optimizing your capacity and getting the training and protecting your frontline healthcare workers. So I think that the response that you see here in Spokane is very strong. Does that get to your question?
Well, and I guess, is it fair for us to expect a few more patients? Is it realistic to expect more patients from Eastern Washington to be coming to Spokane to get treatment?
I would probably reframe that in another way. I would think that you would want to make sure that Yakima was extremely successful in their campaign, and you would set the example for how they could be successful. Because I think that if we're taking this as a collective across the state, then it's not something where we're going to be looking to see how Yakima is disadvantaging Spokane. It's how you're both helping the entirety of the state.
Governor Inslee, you talk about how important it is to wear a mask right now. It's an easy solution, but we've heard some local leaders here say they'll encourage it, but they won't enforce it. In Yakima County, you see the sheriff's office there saying he won't enforce it. What are your thoughts about that?
Well, look, we believe Washingtonians care about each other. We believe they generally think it's a virtue to follow the law, and the law is that we wear a mask right now. And you shouldn't have to have a police officer following you around to get you to follow the law. It is the law. So we think people will adapt to this and adhere to this. We've already seen, as I indicated, increased mask usage, almost double in Yakima County. And I'm very heartened to have confidence that this will happen, because this is what happened in our first round of this. When we first had the stay home, stay healthy order, we didn't have to have police running around arresting people. People just did it because they understood it was going to save lives. And we had massive compliance with it. Now, sure, there were some that didn't, but vast numbers of people complied. We think we should expect the same success here, and I believe that will be the case. So we feel we're on the right track in this regard. And by the way, look, I understand this is a change, right? This is a change. We commonly and traditionally have not done this in the state of Washington. But we have also understood that we can change and do positive things. When I grew up, we didn't wear seatbelts. I didn't think about a seatbelt. But we changed. We started wearing seatbelts. And as a result, a lot of our relatives are alive today because of that. In other words, we can change. We are changing rapidly. I just read, as I was walking in here, quite a number of Republican United States senators are urging the president to wear a mask now. They realize it's frankly silly not to. This is a fight not worth having. We should all agree on this. And so we feel we're going to get good compliance with this, and I feel very positive about Spokane in this regard.
Governor, we know testing is so important. Do you think Washington and Spokane County right now has enough testing and resources overall to handle this pandemic?
Well, we have dramatically increased our testing capacity. It's about 20,000 a day capacity, but there are still some, you might want to think, called glitches to make sure we marry up the viral transport medium to the right person at the right time. So we're still trying to improve the efficacy of that. We also are considering measures to have requirements where people who work in large groups make sure they get tested if there are positives in that place of employment. So we're looking at some options in that regard.
Governor, question about ESD. So what are you doing to help the thousands of families in Eastern Washington who are still waiting for payment, and what are you doing to hold the ESD accountable?
Well, Washingtonians are extremely frustrated waiting for their payments, and that's a frustration that is real and sincere and deep, and I share it. And they deserve a state that is doing everything humanly possible to accelerate the ability to catch up with this avalanche of claims. As you know, the claims went up by a factor of 10, and that's quite a challenge for any organization to ramp up its production by a factor of 10, but it has increased dramatically. And what we're doing is adopting a whole host of new measures to use new technologies, to hire new people. The department's hiring about 100 people every week or two to increase its capacity. Now, simultaneously, it is working to defeat the criminals who are trying to break into this system. As you know, there's an international crime syndicate that has attacked many, many states. So at the same time, the department is accelerating the ability to pay claims. They have to fight off this criminal conspiracy. What I can report to you, there has been some significant improvement. I've met with our director. I talk to her every other day about this, and yesterday she gave me some good news. She's talking to the legislature about that today. You might want to look at some of her information about that. You might find it of interest.
I'm just moving as fast.
Short on time. Are there any outlets that haven't had a chance to ask a question yet that want to?
Yeah, Nick.
Governor, can you talk about what metric or metrics are most important to you when you're looking at the growth of the COVID? I'm thinking of things like the hospital admissions or raw number of cases or deaths. What metrics are important to you?
Well, as we've talked about, there are many metrics that go into this discussion. If I was going to pick the two that I find the three that are most compelling are the new hospitalizations, and that's why we were disturbed today when we found out that the new hospitalizations have doubled here at Spokane County and are predicted to double again in the next 2 weeks. And the R0 number, which is a kind of an assimilation of all the other metrics that give you a prediction of how many people will become infected for everybody who is infected. Now, those two things are sort of the apex of all the other metrics that feed into them, if I was going to pick two different things. But they're, like I said, we look at all of the things that are pertinent, including the hospital capacity, which is not a virus issue, it's a capacity issue. That's an important issue as well.
We're surrounded by counties that are ready to go to level 4. What kind of timetable do you have for the rural counties to move ahead to a level 4 or even a 3.5?
Well, we always look for applications when they come, but I can say that we have concerns in general given this increasing activity across the state of Washington. And we have to be aware of that on a statewide basis because people travel back and forth across county lines. And we do have some concerns about going to huge groups of people that travel across county lines and move the virus back and forth. I won't give you a definitive answer, but I can tell you we have some increasing concerns about that.
Governor, does that also apply to North Idaho as well? There are a lot of people that commute on I-90 back and forth all the time.
Well, we're aware of that, obviously. We're aware of those travel patterns, and we have to take those into considerations when we make decisions. And I understand the difficulty when there's a jurisdictional line, right? But we are Washingtonians. We are smart enough to understand that masks work. We're smart enough to care about our fellow citizens. And we want to get Spokane open again. We want businesses to open again. And we ought to share those views. And if we do, we can put on a mask, and I believe we're going to get Spokane open again. But we need to do that.
Governor, people are starting to get restless, obviously, as they have been, and it's the midsummer that we're about to get into as it peaks up. What's your message to people who are starting to really get tired of trying to contain this virus?
Hey, listen, the best way to not be tired about it is to beat it. And we have the capability to beat it, just like the Gonzaga Bulldogs beats almost every team they play. We need to beat this virus. That's how to quit worrying about it. Let's just beat it. And the way to beat it is to put a little piece of cloth over our face and our nose, and we're going to be victorious, I believe. So good luck to us all. I got to head back. Take care. Wash up, and please mask up. Take care. By the way, the Eagles beat everybody, too, so I want to...